Then we'll go into pharmacokinetics of inhalation anesthetic agents, especially briefly about uptake and distribution of inhalation anesthetic agents. Then we'll go into the individual inhalation anesthetic agents. Okay, you all know that anesthesia was introduced because of the inhalation anesthetic agent only. So almost 1846, October 16th, you all know that William Thomas Green Morton introduced anesthesia to the world. So that is still we are celebrating that October 16th as the World Anesthesia Day. Of course, till 2002, it was being celebrated as the Ether Day. So that was on that day, Gilbert Abbott was the patient, and the Bigelow was the surgeon. Warren and Bigelow were the surgeons, and anesthesia was born because a vascular tumor was removed by providing ether anesthesia. And for a long time, it was only inhalation anesthetic agents only. Anesthesia means inhalation anesthetic agents. And for a long time, even if you go to UK, the anesthetists are called as gasmen. Many people do not know anesthetists are doctors. They think that they give gas. And even in India, I think even when you were kids, probably everybody was thinking about anesthesia means chloroform. I don't know. It was like that only because people do not know much about anesthesia as such. So anesthesia was born because of these volatile anesthetic agents, and still we are using these volatile anesthetic agents only. The second volatile anesthetic agent that was introduced, of course, by James Young Simpson was chloroform. James Young Simpson what was he? Was he an anesthesiologist? What was he? Some of the questions can be asked. Pardon?
Dentist.
No, Martin was a dentist. James Young Simpson was in UK. What was he? He was an obstetrician. He was an obstetrician. So he wanted to find out some drug because, ether was very pungent. And the blood gas solubility coefficient of ether is quite high. It is 12.1. So once the blood gas solubility coefficient is high means the induction and recovery will be very much delayed. So he wanted to find out some chemical or anesthetic which is smooth on the respiratory tract, which is rapidly acting. And he wanted to use that particular anesthetic for cesarean sections and for labor analgesia as well. So that's how, when he was searching for these drugs, he found out chloroform because many of his friends who were chemists, they used to come and then give many of these chemicals to him to try on. During those days, I was telling also that they used to try on themselves. So one evening, they all inhaled chloroform. It was given by one of his chemist friends. So all his friends inhaled chloroform in the night, and the last consciousness, they were found everywhere in the hall next day morning. Then, he thought that this may be an ideal anesthetic agent for cesarean sections. So that's how, he used on pregnant women for cesarean sections, and it became very popular. Chloroform became very, very popular. You must have heard about John Snow. John Snow provided labor analgesia to Queen Victoria for her 8th child and also for 9th child by just using his handkerchief, putting a handkerchief over her face and then dropping chloroform. And, that's how, chloroform became very, very popular. And chloroform was also being used in India as well for many years. And many deaths had occurred because of chloroform in India, because it is quite toxic to the heart as well as the liver. It can produce a lot of, dysrhythmias. That's how you invariably, many times in the first paper, you will be asked about the Hyderabad Commission on chloroform. That is very commonly asked many times regarding in the first paper, instead of, asking about John Snow or W.T.G. Martin. Many times it has been asked as Hyderabad Commission. So this Hyderabad Commission was set up, the first Hyderabad Commission was set up in 1888. And second Hyderabad Commission was set up in 1889. So this is very important because it was financed by Nizam of Hyderabad. He financed it. And, the Edward Laurie, because, you have to write down the short notes for 10 marks. Hyderabad Commission many times is asked. So Edward Laurie was a surgeon. So he was appointed as the principal investigator for this Hyderabad Commission. So they investigated why deaths were occurring because of chloroform. So the commission tried on the chloroform on many dogs. Almost nearly 558 dogs were anesthetized, and then they were high concentration of the drug was given. Then autopsy was done of these dogs. They wanted to find out what is the cause for the mortality because of chloroform. The first commission, 1888, it was inconclusive. That's how another commission was set up in 1889. And it was published in Lancet also. All these things you will have to write down when you are asked about Hyderabad Commission. So Lancet, it was published in 1893. And it was, they gave a lot of advices how to administer chloroform, what are its problems, continuous monitoring the pulse they added. And, another problem with chloroform was, respiratory arrest that it used to produce because a very potent agent, and dysrhythmias. So that's how these Hyderabad Commission you should always remember about. And nitrous oxide, of course, you should always remember who got the credit of introducing nitrous oxide.
Gardner.
Pardon?
Gardner.
Priestley found it in 1770s.
Established as anesthetic agent by Gardner.
Who got the credit of introducing nitrous oxide into anesthesia?
Humphrey Davy.
No, Humphrey Davy was not an anesthesiologist, and he found out actually nitrous oxide, but he was not the one who introduced. Like, Martin did not invent ether. He introduced ether into anesthesia, so the credit of introducing ether to anesthesia was given to William Thomas Green Martin. Like that, nitrous oxide. You must have heard about Horace Wells. Horace Wells got the credit of introducing nitrous oxide to anesthesia. So it was in almost 4 years before ether, in 1842 itself. So because just now Charan was talking about Gardner. Gardner, Quincy, Colton used to bring nitrous oxide. He was a chemist, so he used to bring to many of the cities, and then used to call people for a party, and then he used to make them inhale nitrous oxide. And they used to dance because nitrous oxide will take the people into only the stage of delirium, because it is a very weak anesthetic agent. It can take one only to stage of delirium, that is the second stage of anesthesia. So that's how people used to have a lot of laughter. That's why it is also called as a laughing gas, isn't it? Because people will be in the state of delirium. So there, Horace Wells was also there in that party, and then he finds one person falls, and then he gets an injury to the shin, and then his shin will be bleeding. And that fellow will be still dancing with a lot of laughter. And he asks, "Don't you have pain? You have hurt yourself." He said, What hurt? I've not hurt anything. I've not had any pain or anything. Then he realizes that this can be used for removal of as an anesthetic agent, because Horace Wells was a dentist. So he calls Gordon Quincy Colton to his clinic and makes him to administer nitrous oxide, and gets one of his regular healthy molar tooth extracted. Can you imagine how painful it should have been extracting one of the healthy molar tooth? So that's what. So he did not feel pain. So he wanted to demonstrate publicly, again in same Massachusetts General Hospital, where later, 4 years later, ether was, shown about the its anesthetic efficacy by Martin. So he tried to demonstrate on a medical student for removal of a tooth. Unfortunately, Horace Wells didn't know that the blood gas solubility coefficient of nitrous oxide is very low, 0.42 or 44. So the patient will come out also very fast, recovery. So he provides nitrous oxide, and then the surgeons, they'll come slightly late. By the time they try to hold the tooth, the medical student cries with pain and then runs away from the Massachusetts General Hospital operation theater. So then the Warren rejected. Then he quarrels with his friend, and then he was imprisoned. Horace Wells has been given the credit of introducing nitrous oxide because it is the only, probably the anesthetic. Many of the